Thanks everyone. Thanks to the organisers for having me here today. Not many people invite me to speak because sometimes the message is a bit too in your face. I'll try and keep it very moderate today, and we'll learn a little bit along the way. And I think the things we'll be learning about you already know, so there's not going to be any surprises. Before I begin, I'd like to also acknowledge the traditional owners of the land we're on and pass on my respects to elders past and present. My frame of reference is to focus on alcohol and drugs, and also a little bit about the correction system that we have here in Victoria, which is probably a reflection of what goes on around the country and in many other places around the world. I'll also focus a little bit on evidence-based solutions. That's a positive side of me. I'm not generally positive, but I think that it's worthwhile trying to put things in context because we can change things. And I think some of if we actually introduce some of what we know already, it would impact the lives of tens of thousands of people, not only in Victoria, but nationally and internationally. Millions, in fact. And the transformations which could be achieved would be astounding for our society, for our culture, for our young people, for our community. And really the positiveness that you spoke about before, Aaron, it is there, it's available, but there's so many blockages to this sort of stuff happening. It's a huge challenge that we face in our work. And it's a challenge to the power that be that we need to attack. And we need to articulate our vision and our voice and argue it out with those who currently have power. And we need to disrupt the status quo, because in many ways the status quo is what's harming people. And on a large systemic sort of sense, I think harm reduction and harm minimisation nationally and internationally has disrupted the status quo. It's been a huge movement that's moved the agenda forward in terms of saving people's lives and reducing some of the misery. But there's a long way to go. We need to attack the things that often get implemented through policy paralysis and an absolute void of doing the things that work. Because it's easier to do the things that don't work. And this typifies many of our political systems nationally and internationally. So what I'm going to look at today is a little bit on alcohol and a little bit on drug-related issues in prisons. The first thing I'll do is I'll bring up this chart here, which was done with the help of Professor David Nutt, who came out to Australia last year. He ran his harms study in Australia, and out of that study you can see what the greatest harms are, and it's obviously alcohol. A freely available legal substance in Australia that creates more harm than any other substance. So the study sought to compare the harms from a wide range of substances used in Australia, and similar to what happened in the UK. Alcohol is obviously the substance that creates the most harm, and also the question remains as to why is it that we can't actually handle it? What is it that we're doing wrong? What is it that's creating greater harms? Why is it that we're unable to deal with it? Now, I'm only going to be giving you a vignette of some of the thinking I've got around this, but I suspect, and I think what Peter Miller has to say in a recent paper, The Revolving Door Between Government and Alcohol, Food and Gambling Industries in Australia, really pins it. And what he identified in his research, which is probably well known to us, is that more than 1/3 of people registered on the Australian Government Register of Lobbyists have previously been government representatives. The political revolving door between government and alcohol, food and gambling industry potentially undermines good public health policy by creating an imbalance between the influence of industry and that of public health advocacy. And mechanisms for ensuring healthy, transparent governance need to be established. And some of the things that should be done around this is we need to include revisions to ministerial codes, public servant conditions, and a federal anti-corruption body. And I think the association between those that have an inside running and the rest of us who don't have an inside running is really leading us down the garden path as a society. There's people that spend more time in the corridors than myself in Canberra. I was there a couple of weeks ago, and it was palpable who was walking the corridors. They were pinstripe suits, all those little Australia badges that lots of people have got, and you could just feel these people were influential in that environment. I could barely keep my shirt tucked in, and I just didn't have the same status as them. They're my colleagues representing the alcohol and drug sector who deal with the massive problems that are generated by the industry, don't have a chance, really. And we're all here because we work in this field, and we must be wondering, what is it that we're doing wrong? It's because some people have an inside running, and they take care of themselves, and they don't take care of us. In those words up there, I basically identified that some of the things that we could do is develop a national alcohol strategy, one that isn't influenced by the alcohol industry like the last one was in Australia. That I'm not sure if it's seen the light of day at the moment, but there was a lot of criticism around it because it had been influenced by the industry in a self-serving sort of way. There's a need to pursue broader and more meaningful advertising restrictions. I don't know why we advertise alcohol to young kids during sporting events. There's no real, sporting corporate responsibility in this country. They're quite happy to be advertising alcohol to whoever it is, the same as gambling, actually. We need to look at, and I'm not a wowser by any means, but I think that if some venues are creating continued harm time and time and time again, we need some sort of risk-based venue licensing scheme. We need alcohol tax reform. You can buy, everyone knows how cheap some of the wine is in Australia. You can get some really cheap wine. It's a bit hard to drink, but it's very, very cheap in comparison to other alcohol. And I know this because I buy the cheap. No, but it really is an anomaly that you can buy really cheap alcohol, and there needs to be some sort of equalisation tax in that area. And it's probably one of the greatest policy initiatives you could create to reduce the harms from alcohol. We need a national health prevention strategy highlighting the role that alcohol plays with respect to liver, pancreatic, head, neck cancers in Australia. And I didn't know what to call it, but I called it, we need to pursue a culture of political ethics to address the unhealthy relationship between lobbyists and policymakers. And I think really if we did a fraction of that, we'd all be better off, and it would influence the lives of tens of thousands of people. Now I'm getting into some work I'm currently we're currently looking at the moment, and that's around prison and its impacts. Now, the prison system is really important to us because many of our clients end up there for want of an adequate service system. And what you see in this particular slide is between 2007 and 2017, you've seen a 70% increase in the Victorian prison system. That far outnumbers the population increase in this state, which has also been significant. And it's become the de facto location for treatment and mental health services. Now, mental health services have been stripped out in this state over a number of years. We currently have a Royal Commission, which is a very important inquiry going on, and that inquiry will probably rebuild the system. The take-home message is that continuing to coerce and punish will fail to address people's needs. It's going to increase the harms, it's going to create the clandestine drug profits, it's going to corrupt the political, justice and police enforcement system, and it's going to continue to stigmatise, marginalise suffering massive victims. And so within Victoria, we just this year there was an announcement that they're going to spend $1.8 billion expanding the Victorian prison system, which has already been expanded, and they're going to save $1.82 billion from reducing the public service. So, not that I like public servants that much, but I think I prefer them than more prison cells. And given the damage that occurs in the prison system and the complexity that comes back into our sector, I represent 83 treatment services in Victoria that are getting inundated with correctional prisoners, people coming out of corrections, into our system to be fixed. And we can try and fix part of it, we can't fix it all. In fact, the way we fix it is by solving it to a certain extent and then sending them back to the same shit they came from, which is a real problem because there's no housing, there's no jobs, and the prospects in their life are pretty miserable. So we need to actually have an integrated system. We need to reintegrate people better. And like the Norwegians have done, like the Dutch have done, even the Singaporeans have reduced their recidivism rate down to 26%. It's currently 50% here in Victoria, and it's about 63% for young people. And the churn of women coming in and out of our prison system in this country, in Victoria, is running about 200%. This particular slide gives you an overview of the sort of substance use issues that people who are entering our Victorian prison have. About 70% have got illicit substance use issue in the past year. Very large proportion of smokers. They did introduce a non-smoking policy in Victorian prisons. It sort of worked. They sort of burnt down the prison when they introduced it because I think the Big Bang approach was a problem, but that's a slight issue. And I'll just move on to the next slide, which is also, I think, really interesting because you can see in this one the sort of trauma that most young people that are going into prison with is really, really high. The drug use is really high. Current self-harm, suicidal ideation is also quite significant. So what way do we choose to fix this problem? We stick them in a prison, in isolation, in seclusion. We offer to build a supermax out in the middle of nowhere so that parents and family can't get near them, which I think the government is currently stepping back on. And then we punish them by that sort of isolation. I think what I heard in Norway when I was there is there's only a handful of juveniles in juvenile justice system in Norway. You've got to wonder what it is that we're doing here to create this sort of issue. Now, if you thought the issues weren't getting any worse, this is a result of our prison system. These figures came to me from the coroner's court a couple of weeks ago, and it essentially says they looked at 220 cases in 2017. Some 41% of those cases of death from heroin-involved prisoners. To me, it basically says we've got a death penalty, a de facto death penalty in this country and in Victoria. You put people in prison because they're sick, you make their circumstances worse, you send them back to nothing, and then they die. We should change this. What ends up happening is that you can see from up there the time it takes for people to die. It's very high on initial release, it continues on, and in this case, the majority were dead within a year. 41% were dead within a year. We know that a third of the entrants into prison were homeless prior to incarceration, a third had chronic health conditions, a third were Aboriginal, Torres Strait Islanders, and 2 and 3 female prisoners experienced a mental health condition. So what are we looking for in terms of some of the solutions? We need to fix our mental health system and make it work on outside of the prison rather than put people in the prison. So we need to reintegrate better, and we need to devolve that money out from the prison bill. We need to seriously consider the introduction of decriminalisation and more supervised ejecting facilities, regulated supply, and introduce policies that make a significant difference, including housing, education, training options. I don't think I'm particularly naive in terms of the causes of death from overdose. I know that they're multifactorial and complex, and that's why there is no simple solution. And we need to work across government and across departments, and bringing a broad range of systems together. I believe the Victorian Government is currently looking at this, and the language is still couched in terms of community safety. I'd have more faith if they start talking about human rights obligations, because I think that's really fundamentally what's at stake here. And we definitely need to enhance the post-prison release support programs and focus on... we also need to be aware of the tricks of big pharma, big gaming, big food, big private prisons, of which Victoria is probably one of the major recipients of internationally, and big alcohol. I think I'll leave it there. I think I've covered most of the major points. The rest will be reiteration, but I'll leave you with those points to ponder, and thank you so much for the opportunity to speak.